Assalamualaikum warahmatullahi wabarakatuh. Hi, my name is Brivian Florentis Yustanta. You can call me Brivian. I'm a lecturer in Bachelor of Midwifery Study Program, School of Health Sciences, Karya Husada Kediri, East Java, Indonesia. This is my research under the title The Timeliness of Basic Immunization in Infants Related to the Knowledge about COVID-19. The abstract. During the COVID-19 pandemic, many parents are worried about providing basic immunization for their infants. This caused the basic immunization coverage at Gandusari Public Health Service in Blitar Regency in April 2020 to decrease by 4.9% and in May 2020 to decrease by 19.7%. The study objective to determine the correlation of knowledge about COVID-19 and the timeliness of basic immunization in infants. The status of Gandusari District, Blitar Regency, was an orange zone. During a pandemic, immunization activities are still carried out by implementing the health protocols. Integrated services post or post-yandu activities also continued during the pandemic. All information regarding the immunization schedule was given by the midwife through the WhatsApp group, so that even though they did not meet in person, the information was still maintained. Caters to the waving and measuring body length by door to door. Once a month, an immunization is held, of course by still adhering the established health protocols. The government has announced that coronavirus disease 2019 or COVID-19 as a non-natural global disaster or pandemic. Several efforts were made to prevent the spread of the coronavirus through the social restriction, including limiting crowds, travel restriction, imposing isolation, postponing and canceling events, and also closing the public service facilities. There was 183 or 94% countries in the world have infected. If this condition continues, then the national immunization cover will decrease so that herd immunity will not be formed again. It can cause outbreak of extraordinary disease such as smallpox, polio, tuberculosis, hepatitis B, diphtheria, measles, and tetanus. This will be a double burden for our community and government in the midst of ongoing COVID-19 pandemic. This was East Java Health Office report about basic immunization that the minimum national target is 24%. And East Java coverage was 17% on March 2020. And at Gandusari Public Health Center coverage decreased 4.9% on April and 19.7% on May. The research was correlational analytic with cross-sectional study approach. The variables it divided to, the first is dependent variable was knowledge about COVID-19, and the dependent variable was the timeliness of basic immunization in infants. The research conducted in Tulungrejo Village, Gandusari District, Blitar Regency on June 15th to 26, 2020, the timeliness of basic immunization in infants was measured by maternal and child health booths, as known as PING-booth, like the picture, and the knowledge about COVID-19 was measured by questionnaire. The population in this study were all parents who had an infant, as many as 87. The study used simple random sampling. The sample most of parents who had infants, so the sample size was 71. Based on diagram 1, it was found that out of 71 respondents, it showed that a number of 67 respondents, or 94%, were 20 to 65 years old. We know that 20 to 35 years old is a productive age and also a millennial generation that is highly curious. They can access various information, ultimately increase insight and knowledge. Based on diagram 2, it was found that out of 71 respondents, it showed that a number of 55 respondents, or 78%, had a high school latest education. Knowledge is closely related to the latest formal education. The higher education is expected to higher one's level of knowledge, but the low education also cannot absolutely disconnect that someone have a low knowledge. This can be cause of many things. One of them because the knowledge is not only obtained by formal education, but it can be with the non-formal education. Based on diagram 3, it was found that out of 70 respondents, it showed that a number of 24 respondents, or 34%, had 4 to 8 months in advance. Infants are very susceptible to dangerous disease. They have a high risk of death and prolonged physical and mental suffering, even disability. Complete basic immunization must be fulfilled before they are 12 months old. Based on diagram 4, it was found that out of 71 respondents, it showed that a number of 24 respondents, or 34%, were given diphtheria, pertussis, and tetanus 3 polio 4 to the infants. In the Maternal and Child Health Handbook, there's a table that lists what types of immunization in infants should get and what age immunization should be done. The immunization schedule is made based on the course of the disease, so that when it's given too late, the results are not optimal. And based on the table 1, it was found that out of 71 respondents, it showed that a number of 58 respondents, or 82%, had good knowledge about COVID-19. Knowledge is one of the important things to pay attention to in the context of handling the COVID-19 case. By having a good knowledge of something, person will have the ability to determine and make decisions about how they can deal with it. Based on table 2, it was found that out of 71 respondents, it showed that a number of 62 respondents, or 87%, have immunized on time. There are immunizations that are enough to be done only once. Some are done repeatedly. The immunization schedule itself is made based on recommendation from WHO. So if it missed or there are immunizations that have not been given, it needs to be given immediately and pursued. Based on table 3, it was found that one respondent with good knowledge but not on-time immunization because she was prohibited by her husband and family. There was also one respondent with poor knowledge but on time due to comply the advice of midwife. This is the data analysis. To know the correlation, we use the Chi-square test. With the result, p-value was 0.001 less than 0.05, and the closeness of correlation using contingency coefficient test, the result was 0.371. It means that there was any correlation between knowledge about COVID-19 with the timeliness of basic immunization in infants with a low correlation. So this is the health protocols immunization during a pandemic. The first is wash hand and use hand sanitizer, wear a face mask, temperature check, and keep the distance 1 to 2 meters. And then the conclusion, the first is it was found that out of 71 respondents, it showed that a number of 58 respondents or 82% has a good knowledge about COVID-19. Two, it was found that out of 71 respondents, it showed that a number of 62 respondents or 87% have immunized on time. And three, there was a low correlation between knowledge about COVID-19 and the timeliness of basic immunization. That's all my presentation. Thank you very much for giving my opportunity to present my research. I apologize if there are any mistakes. Wassalamualaikum warahmatullahi wabarakatuh.